Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep your orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. It's nice to see you again this week.
Hi, Allison. As information just keeps coming to us during the pandemic, and CDC made a big announcement on December the 8th this last week since we talked.
Yeah, they did. And so we're actually going to talk about that because it's a change to the guidance on when you can end quarantine after a high-risk COVID exposure. And with the surge in cases right now, that's, excuse me, that's much more likely. So what does this mean, Jackie?
Well, it was a big announcement and quite a big change for CDC. And the very first thing that they started off on the webpage where they announced the changes was to define the difference between quarantine and isolation.
Mm-hmm.
Quarantine is for someone who has been exposed to another person that was infected or was exposed within 6 feet for more than 15 minutes not wearing a mask.
Mm-hmm.
So all of those specifics that we've read about that could put you at risk of acquiring an infection, then you quarantine, and previously CDC had said for 14 days.
Mm-hmm.
Now, isolation is when you are infected and you have to be away from anybody else so that you don't pass the disease on to them. So that's the difference. Quarantine, you've been exposed, but don't definitely have an infection. Isolation, you're infected, and you still need to be away from other people with isolation if you're infected, obviously for that 14 days or so with it. But when CDC looked at making, what's the risk? How high is the risk of someone transferring a disease, say, after 10 days? Then the risk was small enough that CDC modified their guidance and changed that if you've had that high risk exposure, again, within 6 feet without a mask for more than 15 minutes, if you've been in a large gathering of people, all the risk factors that we've become familiar with, then you should quarantine for 7 days. And then if you have a negative COVID-19 test, then it's safe to go ahead and end quarantine and resume going to work and other social activities.
Okay.
If you don't have a negative test, then you should still quarantine for at least 10 days with it. And the reason CDC changed the guidance is looking at when is a person the most highly infectious and at risk of transmitting that virus to someone else. And it's usually in the 2 to 3 days before they develop signs or symptoms, that cough, that fever, a loss of taste or smell, the extreme fatigue that goes with it. And then that 3 to 4 days after they either test positive or identify symptoms. So there's really a 7-day period, if you will, that they're infectious. So going to that 7 days afterwards to be able to end quarantine, it'll reduce the burden on a lot of people who've had to stay out of work. And maybe even, let's say, someone who has a child that tests positive at school, then the parent has to stay at home for 14 days with it. Now we can reduce that to 7 days if they test negative at the end of 7 days, or 10 days that they can return to work. So more manageable, doesn't put quite as big of a burden on everybody with a change in that.
Okay. Now, who does this change in guidance affect? Because it's not everybody.
Well, surprisingly, this is the general population's recommendation. So this is CDC's recommendation to the public, if you will, to the entire United States. What it didn't change was for dental health care professionals. And healthcare professionals in general. If all of the orthodontic team members that are listening go back to the dental website, then they'll see that the guidance is still the same for dental professionals that once you develop the signs and symptoms, that you still need to isolate for that 10 to 14 days, depending on it. And CDC even provides with their guidance the specifics for any healthcare professional. When can you return to work after having had an infection? Whether you were asymptomatic and just tested positive, or whether you had signs or symptoms with it. And there are 3 criteria for it. You always have to go through all 3 of the criteria. Number 1, it's 10 days since you developed signs or symptoms or tested positive with it. Number 2, at least 24 hours since you've had your last fever without fever reducing medicines. And number 3, that symptoms have subsided. They may not completely be gone. You may still have a little bit of a cough with it, or a little bit of that fatigue that goes along, or even your loss of smell. You may have still lost that, but they're subsiding. You are getting better. Because what CDC's identified is, again, it's like a bell curve of the high infectivity. That high infection going up on the bell curve is going to be on that 2 to 3 days before you test positive or have signs or symptoms, and then at 3 to 4 days afterwards. So that gives you that high infectivity. So that's why CDC changed their guidance for the general population. Again, 7 days, negative test, or 10 days without a test.
Okay. Yeah, it's definitely good to keep that in mind, that there is a difference in who this applies to. So for the benefit, Jackie, do you think this guidance may eventually change for dental professionals to get in line with the general public?
I think so, Allison. I think that as CDC gathers more data and we learn more about the infectivity of the virus, that CDC may change that recommendation for healthcare professionals too. We may be able to go to that same 7 days with it. And of course, that would help a lot with staffing in the orthodontic office, because if you have a couple of orthodontic assistants that have to be out for 14 days, that puts a real burden on the team to try to care for patients, or you may even have to cancel patients. So being able to reduce that quarantine time to 7 days would be beneficial for the orthodontic schedule, for the patients, and all the way around. And still maintain safety. We keep people from being at risk.
Yeah, no, exactly. Well, before we wrap up this episode, we actually have an announcement to make. Jackie, I know you have been working with OSAP, and for our viewers who aren't familiar with OSAP, it is the Organization for Safety, Asepsis, and Prevention, and they really are the voice in the industry on the issue of infection control in the dental profession. And now you have partnered with them to offer a scholarship for an orthodontic team member to attend the 2021 virtual 3-day boot camp held in January. And so, Jackie, I wanted to ask you, why are you sponsoring this scholarship, and why should orthodontic team members apply?
Allison, I am so excited about this orthodontic OSAP scholarship with it. As we've talked about, I've been speaking and consulting for over 30 years. And I never sought to be a consultant. It just sort of evolved. And being a member of OSAP and being able to take advantage of the OSAP education and the conference and this learning opportunity, the boot camp is a boots on the ground, basic infection control, comprehensive, hands-on, how to do all of the sterilization, disinfection, hand hygiene, that when you have that educational background, you can communicate that information as an expert. And I never would have been the professional with the confidence at the podium and in doing seminars and webinars that I am today without what I've learned from OSAP. And during this pandemic, I have been busier than ever. And it's made me realize we need more young professionals, because I was sort of the go-to person. There are not a lot of infection preventionists out there for the orthodontist and the orthodontic team members to call and ask for clarification on, well, what do we need? What about, we're running out of disinfectants. What are our alternatives, during this pandemic? So I'm so excited about sponsoring this scholarship for an orthodontic team member to go to OSAP boot camp. And OSAP boot camp, attending it is the first step in becoming a certified dental infection preventionist.
Okay.
So I'd love to inspire a whole tribe, if you will, of orthodontic infection preventionists, the clinicians that understand the orthodontic profession, the instruments we use, how we schedule patients, the patient flow, how we take records, what all of the challenges are for disinfecting, cleaning, sterilizing, packaging instruments that can be of assistance to other orthodontic team members. And as I said, I never dreamed of being a consultant, and I am so thankful and grateful for the opportunity that it has given me over the years, and to be a voice, if you will, for the orthodontic profession. So I'm going to encourage all of those team members who've either heard me at seminars or webinars and come up to me afterwards and say, Jackie, I'd like to do what you do. Now's your opportunity. Apply for the OSAP bootcamp. We created a one-page simple form. Submit your name and a little bit of information in there and get it in by January the 6th.
Right.
Because boot camp is January the 25th through the 28th. So we'll have all of the applications in by January the 6th. We'll review them that week and announce the winner on January the 13th. And then you will have your free scholarship to attend the OSAP boot camp and learn all of the information that you know to be able to either be the best OSHA coordinator in your orthodontic practice, or maybe become an orthodontic consultant to other orthodontic practices as you grow professionally. So this is an opportunity for any interested orthodontic team member that's passionate about infection control, sterilization, and safety to grow professionally now. So I welcome all of those applications. We'll give them the link here, and let's see if we can inspire some new infection preventionists to guide the profession to the next level of excellence and put a little sparkle and shine in. And I guess that's where I need to go now. Why did I title this the Orthodontic Sparkle and Shine Scholarship?
Right. Yes.
Well, I've always used sparkle and shine in doing the webinars and seminars. And what I learned early on was with the dull, sterile information that I have to communicate. OSHA's not known as being the most exciting topic in the world, that if I could put a little sparkle and shine, a little fun, a little bit of humor into it, then I could communicate my message and everyone would learn and the information would stick with them. Because that's the way we humans are. We like the upbeat and the positive, and that's what attracts us. So I'm looking for that sparkle and shine in an orthodontic team member so that you can continue to carry the message forward and share with other orthodontic practices.
Great. Well, as you mentioned, we're going to have the link. We're actually going to have it below in the description to this video.
Good.
So below. And if somebody has any questions or wants to learn, just, seek out more information, can they email you?
Yes, they can email me. I've set up a special email for this. It's orthosparkleandshine@gmail.com. So if they'll email me, then I'll be happy to get you the application, answer any questions, and see if I can share my infectious enthusiasm for the orthodontic profession and inspire you to be all that you can be.
Definitely. Well, infectious enthusiasm is about the only infectious thing we want these days. So that's perfect. All right. Well, Jackie, thank you so much for talking with me today. And we will be back next week for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up on past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.
Thank you, Allison, and thank Orthodontic Products for this opportunity. Keep your sparkle and shine glowing.
Thanks, Jackie.